Hi, I'm Dr. Sharp, and I'm here today to speak with the CHAMP team, and we're going to be talking with 3 researchers who apply the health belief model in their work.
So Dr. Sharp introduced us as the CHAMP Lab, and that stands for Community Health Awareness, Messages, and Prevention. So we're going to talk today about how the M-PACT project uses the health belief model in intervention content and development, and also in evaluation. The M-PACT project stands for Men's Prostate Awareness Church Training. It's funded by the American Cancer Society. It's a 4-year project, and what we basically do is we partner with a local faith community and other community members in Prince George's County. It's a community-based participatory research project. And we recruit and train lay community health advisors or peer health educators from 20 area faith-based organizations or churches. This is a project that aims to increase informed decision-making for prostate cancer screening among African American church attending men. So we asked the community health advisors to go through a curriculum where they're trained in prostate cancer informed decision making and screening. The curriculum is based off of the main constructs of the health belief model, starting with perceived severity. Perceived severity is the idea that a person will take action if they feel like the health condition is severe and that it can hurt them. We find when working in the African American community, we have no trouble convincing community members that cancer is severe. In fact, we find a lot of fear in community members around cancer, and people often consider it to be a death sentence. So how we handle perceived severity in the health belief model and in our curriculum, or what we have the community health advisors teaching people, we try to work on fear reduction and using real people who have survived prostate cancer, asking them to tell their testimonies or their stories or share their stories with the group of people in the workshops. And when they do so, it gives people a sense of, okay, I can survive this. If it's detected early, I can survive this. And a fear reduction. Using the testimonies and working on fear reduction, we can encourage people that cancer, it is serious, but it's not necessarily that death sentence in every case. If we find it early, it can be treated successfully.
So now we're going to move into talking about perceived susceptibility. So perceived susceptibility, in our project, we focus a lot on the risk factors for the African American male community. So the M-PACT project focuses on African American men ages 40 to 69. African American men are at the highest risk for prostate cancer. 1 in 5 are diagnosed with prostate cancer. Some of the risk factors that we address in our project, particularly in training and in the workshop, is a family history of prostate cancer. So that is one of the ways that we address their susceptibility to getting the disease. A lot of the discussions in the workshops focus a lot on their particular diet and exercise. Some of the men have shared about how the African American diet contains a lot high in salt and fat, and they acknowledge the fact, but also acknowledge the fact that this needs to change, or they need to find other ways around that. And within the discussion amongst the men, they work through that together. We focused a lot on just making sure that they know that they're susceptible to it, but there are ways around it as well.
Next, we're going to talk about perceived barriers. And it was very important for us in this church-based intervention aimed at African American men to really listen to the men and really look at and listen to their barriers that they have in general for cancer, what they felt about cancer, and how to best then develop materials to be responsive to their perceived barriers. And so what we did earlier on in the project, and I should say that the project was about a year in terms of formative research, so that's quite a bit of time in terms of really meeting with our advisory panel members, conducting 2 focus groups. And we conducted 2 focus groups earlier on in the project with the men that were similar to the similar demographics with the target population that we wanted to implement the intervention. And so they told us some really very good things that we've actually identified and put into our curriculum materials. One of the things in terms of perceived barriers, they mentioned the whole thing, and Dr. Holt mentioned it earlier about fear. What they've heard about in the community is you die from cancer. Cancer is a death sentence. And they had family members. Some of them had experienced uncles and fathers or other family members that may have not have been affected by prostate cancer, but some other type of cancer. So that was a really concern for them. They also were concerned about, okay, what if we're diagnosed? Then treatment options. Big thing in terms of, will my sexual organ work, quote unquote. They want to be able to have sex and be able to have, and they were feared of knowing, and then, okay, then being responsible for having to do something about that. So that was, we really included information about that in terms of the treatment options, and these are, viable choices that you can based upon, your age, and then certainly encouraging men to establish a relationship with their doctor and get screened for prostate cancer so that they could find out earlier on if they needed treatment, and so that they can have less evasive treatment options. Also, another thing was access to health care. A lot of them talk about insurance and not being able to have coverage for some of the screening tests. And so we put together a resource directory for individuals if they underinsured, uninsured, and so that they can identify places for screening. And so that's just one example of some of the materials that we try to get at to for this particular construct of perceived barriers.
Our curriculum, this is our Community Health Advisor Training Manual, and you can see that it is thick and lengthy. It has a number of modules in it, which we train the community health advisors, and not only in that, parts of the health belief model and elements of it, but in all sorts of different topics that they're going to need to be able to talk to their peers about prostate cancer and screening, etc. So that is a number of modules that they go through in their training curriculum. But also the way that we address perceived benefits of screening for prostate cancer. This also gets a little bit tricky because with the recent controversy about whether every man should be screened for prostate cancer, that's receiving a lot of attention in the media in recent years, and also the U.S. Preventive Services Task Force and how that impacts screening guidelines, and it has impacted screening guidelines. The American Urological Association still recommending PSA screening. American Cancer Society is still standing behind screening, but again, the task force not so much. So we've got some conflicting screening guidelines, and we, work those into our program and trying to send a clear message to gentlemen about informed decision making for screening, and what does that mean. We could teach a whole other class on that, but men do find a lot of challenges in going to the doctor, and that's why it's so difficult to work in men's health, and also so significant, I think, to work in men's health, because men are having challenges in going to the doctor. They're not always, and I'm talking as a group, I'm not trying to pinpoint any one person, because we all know there's a lot of guys really good about going to the doctor and keeping an attention on their health, but as a group, preventive health care is very difficult for men. Difficult to get off work, difficult to get to a healthcare organization or system, and when it's convenient for them. And so as a provider, there's a lot of issues that are they're making it difficult, as Dr. Saunders addressed barriers that are making it difficult for men to see the doctor. Trying to motivate men about preventive care is very difficult. And so a couple of primary strategies that we have used in M-PACT revolve around preventive maintenance, if you will, thinking about our bodies like something that needs to be maintained and cared for. Men know about maintaining things like a vehicle that they have, and they are accustomed to doing that and know about the consequences of not doing that, about a breakdown, about engine failure, etc. And so we have used messages that have resonated with men about motivations for keeping healthy, about keeping that preventive maintenance going with the body. Another message that has resonated in this project, that again, we're not coming up with these